My name is Megan and I'm a gynaecology nurse at University Hospital Sussex. Welcome to the Outpatient Hysteroscopy Suite. In this video, we will explain what a hysteroscopy is, how you can prepare, how the procedure is undertaken, and what your choices are. It is important that you read or have someone read to you the patient information leaflet, which will be sent to you prior to your procedure to prepare for your appointment. This video has been prepared to cover hospitals within the Surrey and Sussex area, so please note that there may be some slight differences on the day, depending on which hospital you will be having your procedure at. An outpatient hysteroscopy usually takes between 10 to 15 minutes, although you will be booked for either a 30-minute or 40-minute appointment to allow time for a discussion with the clinician before and after. You will usually be able to go home shortly after the procedure.
My name is Bronwyn and I'm a consultant gynaecologist at University Hospital Sussex. You may have been referred for a hysteroscopy because you are experiencing symptoms such as bleeding after the menopause, irregular or heavy menstrual bleeding, fertility concerns, or if an ultrasound scan has detected polyps in the lining of your womb or a fibroid. An outpatient hysteroscopy procedure enables the doctor or specialist nurse to examine the inside of your womb, also called your uterus, using a thin camera. You will be awake during this hysteroscopy.
How to prepare for your appointment. It is likely that you will experience cramp-like pain. Taking pain relief a short time before the procedure can help to lessen any discomfort you might feel. Please take some paracetamol or ibuprofen about an hour before your appointment, unless you are allergic or are already taking them. Please follow the instructions on the packet about how much to take. You can eat and drink before the appointment and try to have a good breakfast before a morning appointment or lunch before an afternoon appointment.
There will be some discomfort or pain experienced during the hysteroscopy, and this will be different for each patient. Most patients are able to talk throughout the procedure and tolerate it well with a low level of pain, whereas some find it painful. During the procedure, we may be able to offer additional types of pain relief. If at any time the procedure becomes too much, please say, and we can stop and discuss other options with you. There will be a healthcare assistant or nurse present throughout to support you. However, you are welcome to arrange for someone to come with you to your appointment to provide additional support. If you have any additional requirements or communication needs, please let a health professional know before your appointment so that this can be arranged for you. Approximately 90% of hysteroscopies are performed in an outpatient clinic. However, if you do have any concern that you may not be able to have a hysteroscopy while being awake, an alternative option would be to have it done under a general anaesthetic, where you would be asleep. Our patient information leaflet gives you advice on how to arrange this.
What will happen when you arrive? When you arrive, you will come to the outpatient reception and waiting area. Please be aware that for premenopausal patients, we may ask you to provide a urine sample for a routine pregnancy test. Prior to the hysteroscopy, you will have a consultation with the clinician or specialist nurse performing the procedure. During this consultation, you will have an opportunity to ask any questions you may have. The clinician or nurse will then ask you to sign a consent form, which will summarise the procedure, as well as the benefits, risks, and alternatives of having this done. You may also be asked if you would give consent for a student nurse or doctor to observe for teaching purposes. Once you have given consent, you will then be shown into a separate area where you will have your hysteroscopy procedure. At some hospitals, the consultation and the hysteroscopy will both take place in the same room. Please let us know if you have any requests for adjustments to the room, and we will try our best to accommodate these. There is a private changing area for you to use to get ready. The chair which you sit on for the hysteroscopy can be adjusted for your comfort.
When you're ready and comfortable, the hysteroscopy will begin. We use a very small telescope that's inserted through the cervix, otherwise known as the neck of the womb. We use fluid with a telescope which separates the walls of the uterus so that we can see properly during your hysteroscopy procedure.
What will happen during your hysteroscopy?
The image from the camera will be shown on a screen in the room. You are welcome to view this image at the same time as the team, but you don't need to if you would prefer not to. Throughout the hysteroscopy, there will be a healthcare assistant with you to provide support. If you are experiencing any discomfort or pain, remember we may be able to offer additional pain relief options, including local anesthetic injections into the cervix or pain relief that can be inhaled. You are always in control. Please let the team know if at any time you would like the procedure to be paused or stopped. The purpose of this appointment is to find the cause of your problem and to plan or complete the treatment needed. If a polyp or small fibroid is found, we are usually able to remove this during the hysteroscopy. This is a preferred option as it means you will not have to return for a further appointment. A small tissue sample may also be taken during the hysteroscopy, known as a biopsy, which will be sent away for testing.
What will happen after the hysteroscopy?
The clinician will talk you through what they see as they go through the procedure. You will have an opportunity for a discussion of the findings and ongoing care before you leave. If any samples are sent away, the clinical team will be in touch with you regarding the results.
Most patients recover well from an outpatient hysteroscopy. You will experience watery discharge and possibly some light bleeding and cramping. Sanitary protection is available for you to use, or you can bring your preferred sanitary towel with you. If you need any, please do ask. The team will ensure that you are comfortable and safe to go home. Our patient information leaflet has contact details for our team if you are concerned about anything.